Hello, my name is Nick Cohen. I'm a doctor, and I'm here to share with you a top 10 list of tips for children with asthma. Tip number 1 is frequent hand washing. Children with asthma are more likely to get worse from their asthma when they get colds. And the best way to prevent colds is to have children wash their hands frequently. Tip number 2 is to get the flu vaccine. The flu vaccine is recommended for all children, and in children with asthma who can get viral illnesses, influenza vaccine can prevent worse symptoms from asthma. Hello, my name is Nick Cohen. I'm a doctor, and I'm here to share with you a top 10 list of tips for children with asthma. First tip is a good way to help prevent asthma. Wash your hands. Children are more likely to get sick when they don't wash their hands, and washing their hands by preventing illness prevents asthma from getting worse. Tip number 2 is to get the flu vaccine. All children should get the flu vaccine, but kids with asthma are sicker when they get the flu, so the flu vaccine is especially recommended for children with asthma. Tip number 3 is wherever your child lives, make sure you wash everything in the house once a week. So this includes sheets, pillowcases, and blankets. Now, all surfaces collect dust, and dust is a major trigger for asthma. So it's important if you have floors to wash your floors. If you have carpets, it's important to vacuum your carpets with a HEPA filter each week. If you have a choice, it's better to have floors than carpets because carpets collect dust more easily than floors. Also, it's important, if you can, to avoid having upholstered furniture in your house. Once again, everything should be washed once a week. So if it's in your house and it's not easy to be, and it's a surface that isn't easily washed, then it can collect dust and make asthma worse. Tip number 4 is avoid your child being exposed to secondhand smoke. If you smoke, quitting smoking is the most important thing you can do for your health, but it's also a great way to help your child not have severe asthma. Smoke exposure makes asthma worse. And if you must smoke, you should smoke outside of the house. However, smoke is on your clothes, smoke is in your hair, so quitting smoking is the most effective way to avoid your child being affected by smoke. Tip number 5 is have a HEPA air filter in your child's bedroom. The reason I say the bedroom is because that's most likely where your child spends most of the time inside the house. And a HEPA air filter has been proven to remove air particles from the air that can make asthma worse. Tip number 6 is to, if possible, avoid having pets in the house. Now, not all children are worse in their asthma from pets, but pet dander is a major cause of asthma being worse in kids. So if you do have a dog or a cat, for example, in your house, it would be better to not, because it more than likely is making your child's asthma worse. Tip number 7, if your child's asthma is made worse with exercise, then have her take a puff of albuterol 10 minutes before she exercises. This is a way of preventing exercise-induced asthma, and it's very important for kids with asthma to exercise regularly like all kids. Tip number 8 is use your albuterol inhaler as a rescue medication. So if your child is having an attack of asthma, which could be feeling their chest tighten, or having shortness of breath or a cough, then they should use 1 to 2 puffs from their asthma inhaler. And they can repeat this every 4 to 6 hours. tip number 9 is to use the controller medication. So working with your doctor, there's a variety of medications and you step up from one to the next. If the bottom step in the ladder for asthma control medications doesn't work, you step up to the next step. Controller medications are recommended when your child is using the albuterol inhaler more than twice a week. So the first step in the ladder is a inhaled corticosteroid. Its brand names are Pulmicort or Flovent, for example. And these are medications that should be used as soon as your child is using their inhaler more than twice a week. Now that's the first step, so inhaled corticosteroids, Pulmicort or Flovent. The next step is Singulair, montelukast, which is a leukotriene inhibitor, and it is especially useful for children with allergic symptoms related to their asthma. So after you've tried the Flovent and Pulmicort, if the symptoms are still not controlled and your child is using their inhaler more than twice a week or is limited in their activity by asthma, then the next step is Singulair or montelukast. If that doesn't work, then the step up from there is an albuterol, is a long-acting beta agonist and combined with an inhaled corticosteroid. The most common brand name is Advair. And this is, once you start this one, you'd want to stop the Flovent or Pulmicort because that's also inhaled corticosteroid. But this is an inhaled corticosteroid combined with another medication, a long-acting beta agonist. So this would be the last step, the highest step in the controller medications. So once again, the low step for the first step after your albuterol is used more than twice a week is Pulmicort or Flovent. The next step is Singulair, and the next step after that is Advair or fluticasone and salmeterol. So it is important when you start using these controller medications to work closely with your doctor to make sure that your child is taking the lowest possible step in the ladder as is needed to control symptoms. And tip number 10 is to believe in yourself. Working with your child and your doctor in controlling your child's asthma is very important to your child's health. And your child can live a normal and healthy life when you can help them control their asthma. So I hope these tips are helpful, and thank you for your time. Have a great day.